Hello. Hey. Welcome to my channel. My name is Tada. I work in mental health. I have a background as a therapist, and I would say I'm a politicized therapist because social justice is really important to me. It's baked into my work. It's a big part of my work, and I wanted to get in on that kind of Yang content game because I'm a supporter, follower, but live up in Canada. So, I don't get to join all the fun, but thought I might inject myself through via the internet. And the thing I wanted to talk to you today about is something that's really, I think, important to me, and also something that's been a bit controversial, which is basically Andrew's healthcare plan, because there's been a lot of kind of controversy, uproar. I think a lot of Bernie supporters and other progressive people have been, understandably quite I guess triggered by it. I think is like the right way to say it. They're having a lot of trust issues and things around it, and and I think even that's true for like the Yang gang and people who are Yang curious as well. So yeah, I wanted to offer you what I think I would say is Andrew's real healthcare plan. And something that I think I want to start off with as a person who does, mental health work, is something that we have to understand is that mental health is actually the foundation for all other kinds of health. Mental health is the thing. So when you're talking about those big illnesses that cost a lot of money and a lot of heartache, let's say diabetes, cancer, even chronic conditions or chronic fatigue, fibromyalgia, all kinds of, all kinds of chronic syndromes, chronic illnesses, all of those are affected by stress. That is the number one cause of them. And so one of the things we need to understand is that, I think Andrew is one of the only people in the current contender field that really has an orientation towards mental health, and it's something that's actually very important to him. And the thing where it shows up is actually, and where it's really important, is that it actually is one of the foundations or one of the big elements in his human-centered capitalism, or human-centered economy if you don't like the word capitalism, but human-centered capitalism. Underneath that, he has metrics that he says governments need to design the economy around and guide the economy around. So the economy is not accountable to creating more GDP growth, but also to these human metrics, principally, that showcase our well-being. So that would include things like life expectancy, freedom from substance abuse, mental health, childhood success rates, and all these other kinds of metrics that are actually available to us, right? And why this is so important is because it actually doesn't matter what his execution strategy is when you think about it, as much as the values that he's saying government is accountable to. So he's saying that the American scorecard is how he's branding it, but regardless if you're a libertarian, conservative, liberal, progressive, we are accountable to those things, regardless of our ideology. It's very pragmatic in a way, but very guided and pointed. And so that is, I think, the context that we need to understand his healthcare plan. And I'm going to say, based on that, his number one healthcare policy, and maybe the number one healthcare policy that's actually kind of a sleeper in the entire field, is universal basic income, right? Because what does universal basic income do? It alleviates stress. And we already said, number one cause of human health breakdown is stress. It's the thing that's affecting us when we're not quote unquote sick. So I think what needs to be articulated, because I think so much the language around healthcare policy in this election cycle is in a, for better or worse, is pivoted around Bernie Sanders' Medicare for all. He says, I wrote the damn bill, which is true and untrue because there's so many versions of it, but it's really his identity is tied. I'm going to bring you Medicare for all. And I think a lot of progressives especially use that as kind of a shit test. And also everybody else is like Medicare for all who want it, are finding different variations of it. And they're like trying to brand off of Medicare for all. And I think in Andrew's search for his political identity, started off with Medicare for all in his plank. But I think something that, I think he said it already actually, is that, when he was asked a question by a town hall person, is that maybe universal healthcare is actually like a better description, because that's really what you're trying to get to. The name of the thing doesn't matter, but the content does, right? And the reason why I think that's important is because to not have the conversation driven by people who don't actually think like him. Because the thing is, when you look at human-centered capitalism, you understand that Andrew, if you trust in his face value, what he's putting out there into the world, and he says what he means, if you trust that, he's a very holistic thinker. He understands and tries to understand how all these different parts fit together. So that's why this human-centered capitalism is actually really the foundation of his campaign. The universal basic income is that kind of like this flagship that's flashy, and it's kind of like maybe this like, thing that people get attracted to originally. But actually, when you look at the foundation of his substance, is all in the human-centered capitalism plank. That is the very foundational layer. And universal basic income is actually built on top because it's something that is so effective right away, that can affect all those metrics that he wants to measure, right? Because, and people have this critique of Andrew's like, oh, he's like the one-trick pony guy, the UBI guy. That's like, yeah, but if you understood that how much of our problems are solved by direct cash transfer, like it's ridiculous. Actually, he's one trick pony guy because the pony does the trick for everything. Like that cash transfer does so much because what does it do? It alleviates stress, right? And that's why it's important. It's not like a huge lump sum of money. It's this sum of money that comes in consistently. So it creates this foundational floor. It's not like a windfall, right? It's this constant drip of money. And that psychologically has a humongous impact. There's lots of things we can talk about. We can talk about attachment and stuff like that, but and other psychotherapeutic concepts. But I just want you to understand that, like, versus like getting a lump sum all of a sudden, this constant drip of an amount of money that is supportive and buoying, but not like way too much. Like way too much would be like 10,000. So, because to be honest, I think UBI could be higher. I think it could be even 2,000. But like a sum of money that's buoyant, but it's not like ridiculous, like $1 million, or is actually really supportive to a person. Because when you get huge lumps of cash, it causes its own stress by having too much, and it, like in some ways, like you can think about it, you go from a real low to like all of a sudden this high. And, we hear stories, definitely about people who all of a sudden come into a windfall, and it doesn't necessarily make them happier other than the moment that they're flush with the cash. When you think about the long term, there's something really amazing about having this steady floor, especially if it's tied to, inflation. So anyways, that's like more about, that's probably, we had to really understand that, we probably had to talk a little bit more psychology, but just this idea then that you're getting this $1,000 a month, let's say, or some kind of UBI that's alleviating stress. So what that's doing is supporting your health when you're not needing to access healthcare. Because what healthcare, we call it as usually, is care for when we are sick. And so I think the Medicare for all people are really worried about what happens when we get sick. What happens when we get sick? And that's really their primary concern. But there's this whole other part of health is when we're not ill. And the stress matters in that period, especially. And universal basic income is such, I believe, can be a powerful force in addressing so many issues on such a wide level, if you think about it, because it alleviates things like the time we need to work, because a lot of people develop disabilities because they've been laboring so hard because of lower back pain, arthritis, all kinds of stuff, like, all these chronic ailments. And so, and people like getting to do what they want to do, having the freedom is like really, the health effects of like UBI, I think, is something that it's just like so obvious when you actually realize it. You just imagine, what if your family of 5 people and 3 of them are adults, I don't know, whatever, is getting $3,000 a month. And could you think it have an effect on health? Yes. Now, so what I think it's important to understand Andrew's healthcare plan is in the context of all this other stuff that it's also working with. And maybe one way I understand it, and I hope that the campaign actually goes in this direction, and I trust in my good faith that this is actually what Andrew is really saying, is that it's actually universal basic income, universal healthcare, right? This is the thing that sustains you all the time. This is the thing that's there when you need, right? And then underneath, to keep that all accountable, is this human-centered capitalism. So that's actually how it looks. So the problem I think the campaign is having, and all of us are having, is that the language around healthcare has been so controlled and branded around Bernie, and it's actually something that Andrew needs to grow out of, like become, in a sense, his own person around, and develop his own language. So we're not having to deal with these shit tests, and we can see Andrew's plan for its true capacity. Because if you think about it, if Medicare for all, or some kind of universal healthcare, right, is a pretty hard thing to pass through the government based on the demographic and the makeup of the current, Congress and stuff. So, think about that, right? Imagine not having UBI during that period versus having it. So imagine that people are able to, with an influx of cash, are able to purchase private healthcare plans, are able to afford medication right away, because I think UBI, Andrew argues that it'll have a much easier time getting through the government. Yeah, I would agree with that based on his analysis, and if we trust that is something that is doable and achievable, that vision is, then what you're going to see is that even while this reform to healthcare, which includes prescription drug costs, changing the salary style of doctors, giving nurse practitioners more power, all this foundational change that needs to happen, probably even way more than that's even in his plan, needs to happen, and creating a public healthcare plan, like a public universal healthcare plan, no matter what its style is, it allows people to actually immediately get healthier, cut their costs, and alleviate the system even before putting in that transition that could already be rocky. And it actually might be that having a UBI will actually transition that healthcare system faster, safer, and more sustainably, right? Because one of the things about the healthcare system is so hard to change is so many people employed by it and so much money is going through it. UBI provides this kind of floor that allows for industries to transition, and that's actually one of the things Andrew's seeing, is that actually people need an ability to transition, and UBI could, I think, definitely can probably help reducing some of the resistance. I could end up being wrong, but I think it can actually possibly have some influence in allowing these companies to transition well. you know, but, because, at the end of the day, of course, like, if you had a system versus where a company goes bankrupt and nobody gets anything versus a company goes, fades away, but everybody who's employed by that company still has an income floor, and they know that they have that income floor. They never have to apply for anything to actually start kicking in. That's actually a lot safer system. So you might have some effect on things being easier. Honestly, I can't probably measure that accurately thinking out the top of my head because it may not matter as much, but I think it's something worth considering. But especially for people who are just, you know, civilians wanting to access the healthcare system, having an influx of cash definitely helps with that ability right away. And I think that's something really important to understand. And that I think there's places, when they talk about, there's places for incrementalism and there are places for radical change really quickly. In terms of getting people a floor, in terms of getting everybody the minimum support that they need to change, that has to be all of a sudden. The cuts go right away. But in terms of the actual shifts that are more like systemic and embedded, it takes a long time. And this is actually, I'm going to say this as a therapist. This is actually a very important concept of therapy too. Like, for people to actually work on their mental health, they need a certain minimum of resources, which can include things like housing and finances, that allows them to have enough headroom in their mental health and their well-being and their emotional well-being to make changes, right? And so what I see is that there's an immediate necessity to offer people that alleviation of stress to create that headroom. And then the other changes that are a lot more complex have a time to unfold incrementally, or they need to transition incrementally. So there's a place where we are best to be incremental, because we can't, when we disrupt in this industry too fast, it can create consequences we don't even understand. But there's immediate necessity to get people immediate relief to be able to make that change. It's a very, it's a balancing act, because I know people are going to say, like, people are dying right now in this current healthcare system, and I totally see that. That's totally valid. So it is a balancing act. You can, rub your belly and pat your head at the same time. But I think there is no doubt that, a universal basic income would be such an immediate alleviation of things of stress, the basic thing that affects every aspect of our well-being and every aspect of the economy, that we have to really consider that is actually a part of Andrew's healthcare plan. And that's why I say this is Andrew's real healthcare plan, is we have to see the whole thing. And I'm hoping that, as his campaign matures and we're getting into that critical stage, that he has the language, he develops the language, maybe even breaks from Medicare for All, because I was never happy to see it. To be honest, when I saw freedom dividend, human-centered economy, I was like, oh, this is awesome. And the Medicare for All thing, I was like, oh, that feels like somebody else's thing. It feels like that's not him. But I trust that from everything that I've seen, my best trust is that Andrew is a person that's evolving in this campaign. That's one of the exciting things, is to watch him grow. Even from the debates, you see him grow in his capacity. And that's something that's very different. And it's not that he's flip-flopping as much as he's improving. Because I think people, because he says lots of stuff that's not poll tested, like decriminalizing or, opioids and things like that are just he goes with what he feels is best and puts it out there. And he's not doing this poll tested thing, right? We know the people who are doing that kind of stuff. So if you think he's flip-flopping, I think it's actually more that he's actually growing. And there's a bit of a discomfort period where we don't really know what he's going to do next, because he's kind of an original person. When you look at the freedom dividend and human-centered capitalism, there's very unique ideas in the candidate field. And I think for him to really follow through with that, there's something about him, he was kind of hanging off of Medicare for all, but he needs to essentially get away from Medicare for all and like create his new language. Personally, I hope it kind of looks like UBI, universal healthcare, and then like human-centered capitalism underneath. Like show it as this like not necessarily like this three-prong thing that with actually universal healthcare like drifting off in a little bit, and then UBI and human-centered capital make sense together. But you're like on healthcare, you're like not doing that much original stuff. You're just kind of like public option. Yeah, it's like just this not very powerful language. I think he can do better than that. I think he can really put forward his own language, and I'm really hoping that we see that, and I think we'll get really pumped if he can put together that kind of a comprehensive platform that's digestible and it makes sense to everybody, that it all works together. I don't think it's even going to matter if he's on the debate stage for Iowa at all. Like, I think actually getting his message right is actually more important, and his development as a candidate is actually more important, possibly even. So, really excited to see what happens with that. In my good faith, I believe this is really where Andrew's coming from. And I think that, my reason for believing that his healthcare plan is like really deeply rooted in his general understanding of human well-being. And it's really this human-centered capitalist foundation, because you have to understand that's what he's saying he's accountable to. He's saying the human being is what the economy is accountable to. So whatever the strategies he creates to address things like income inequality and healthcare come out of that. So if we feel like, especially in the Yang Gang, Yang Curious folks, if we get confused about that, or if you're somebody who's upset by this healthcare plan, you're not a Yang supporter, I invite you to think about it a little bit more and go like, oh, this human-centered capitalism thing, regardless of your party's ideology or whatever your group's ideology is, it really holds you to values that make sense for an economy to be accountable to, regardless of how you think. That really is actually the really important takeaway. So that's my comment for today, and hope you enjoyed, and it's fun to join the Yang universe. Peace.